Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, we're talking about a new device specifically designed to help patients with irregular heartbeats and high risk of stroke. This innovative technology is called the Watchman, and just like the name suggests, it helps patients manage and monitor their condition by eliminating the need for blood thinning medication for the rest of their lives. The device is ideal for people who dislike taking medication and, more importantly, for people who suffer serious side effects. Dr. Charles Joyner with Levinson Heart Institute at Chippenham Hospital is here to talk more about this. And I'm holding the Watchman. This is the Watchman, a very lightweight, almost. Look at this. It's unbelievable, the technology that went into this. Tell us how it works.
Sure. It looks like a very small, simple device, but the engineering is incredible. Basically, over the past 10 years, the company Boston Scientific has devised this, and it got approved by the FDA in March. This little guy comes folded up in a sheath, which is a long tube that we put in blood vessels. It gets passed up and then deployed in an area of the heart where we think blood clots come from in people who have atrial fibrillation.
It is amazing. And explain the connection between stroke and atrial fibrillation.
Yeah, there's a very strong connection. A lot of people have atrial fibrillation, and we think that maybe 5 million or more in this country alone have it. It places you at very high risk for stroke compared to normal folks, and the more risk factors you have, the higher your chances. So people who have atrial fibrillation, the top chambers of their heart beat kind of chaotically. They don't eject blood like they should. Blood can swirl and coagulate inside of the chambers, form clots. If those clots escape, they can go into the circulation and cause a stroke.
Who are the candidates for this new technology, the Watchman? Who would be special candidates, and who would be skilled at implanting this in the heart?
Sure. For the first question, who are the candidates? Basically, if you have atrial fibrillation and therefore have a risk of stroke, you're going to be on a blood thinner more than likely. That should be recommended. It's not recommended as much as we want, but in the vast majority they do get that recommendation, and they should stay on it for life. Well, if people can take warfarin but either don't want to or don't want to subject themselves to the long-term risk, this can be implanted. So it's kind of up to the patient and the doctor, but the indications are fairly open as long as you can take warfarin, because you do have to take it for a short period of time once this is put in. So people who have a risk of stroke and who can take warfarin currently are the ones who are approved in the United States who can get this device. Now, who puts the device in? You have to go to a doctor that is trained in putting this in specifically. Usually that's what we call a cardiac electrophysiologist like myself or my partners, and we are trained to put this in the very specific way. This little guy fits in very, oh, it's so light it floats around.
It is just amazing. I'm fascinated by
it. It's down to really millimeters of measurements and positioning to get it in just right. But once it's in, it plugs up this opening in this crevice of the heart and blocks the blood clots.
Excellent. Thank you so much for sharing all that information.
Sure.
We appreciate it. And to learn more about the Watchman, just go to NBC12.com and click on Neighborhood Health Watch. Ross?